Congratulations on the birth of your son, and welcome to our Gentle Procedures Clinic. Although it's natural for parents to be nervous before their child's procedure, especially one involving a newborn, there's little reason to worry. Tens of thousands of these procedures have been successfully performed at our clinics, and the chance of complications with our technique is exceedingly low. By following the instructions in this video, you will help ensure a gentle and easy procedure, as well as a quick and full recovery for your son. In a few minutes, you and your child will be led into the procedure room. Once inside, we ask that you put a fresh diaper on your son. We will then go over how to properly swaddle your child. Next, you will find a container in the room with 2 sugar balls made of granulated brown sugar dipped in grape juice. Studies have shown that these sugar balls act as a distraction and minimize any pain your child might feel during the procedure. We recommend you give your son the first sugar ball once he is properly secured on the baby tray. Before putting it into your baby's mouth, squeeze any extra juice into the container to prevent choking. Hold the tail end of the sugar ball, place it completely in your baby's mouth, and let him suck on it like a soother. Before switching to the second ball, make sure the first ball is completely flat. Next, the doctor will enter the room and do a physical assessment of your child. If for any reason your baby is not a candidate for the circumcision, you will be advised by the doctor, given an explanation, and a full refund. Otherwise, the doctor will then give your son a local anesthetic. By now, your son will have already received a topical anesthetic to further increase his comfort during the procedure. 5 to 10 minutes later, the doctor will return to perform the circumcision. You are free to leave right after the procedure unless the doctor asks you to stay for observation. Please note, all the information in this video is set out in the manual, along with the doctor's emergency phone number. If you have any questions related to post-operative care, please call the office. In case of a medical emergency, please call the doctor immediately on their emergency number. In the supplies you have received, you'll find a package of gauze and a tube of Vaseline. When your baby leaves today, he will have 2 pieces of gauze on his penis. The first piece of gauze is wrapped around his penis. The other one is placed on top. For the first 24 hours after the procedure, the pieces of gauze should be left alone. Do not try to remove them. If the gauze is soiled with urine or stool, just leave it alone. If the top piece of gauze comes off before 24 hours are up, you will need to replace it. Squeeze a quarter-sized dab of Vaseline onto a fresh piece of gauze and place it gently on top of your baby's penis. If the gauze that is wrapped around your baby's penis comes off before 24 hours are up, don't worry, just leave it. It does not need to be replaced. After 24 hours, you will need to remove all the pieces of gauze. In the event that the gauze sticks to the penis, find the end of the gauze and pull firmly but gently to remove it. You may also use a little warm water to loosen it. A little bit of bleeding is normal. After removing the gauze, continue applying Vaseline to the penis at each diaper change for the next 14 days. It is normal for the gauze that comes off the penis to have blood stains. What is not normal is for the penis to continuously drip or ooze blood. Please check your son's diaper every hour for the first 24 hours to look for any abnormal bleeding. If you notice this type of bleeding, apply direct pressure to the penis as demonstrated by our staff for 3 minutes at a time, releasing pressure for 3 to 5 seconds in between. Repeat this for 9 minutes in total and call the doctor immediately on their emergency number if the bleeding persists. Most babies sleep through the procedure, and when they leave the office, they are quiet and calm. There's a good chance your baby will be very sleepy and will sleep for 6 to 8 hours after the procedure. This is completely normal. However, there is a small chance a baby might get upset after the procedure and begin crying as the anesthetic wears off. This is usually short-lived and is not harmful for the child. If you feel his discomfort is persisting, you may give your child an additional 0.5 milliliters of the infant Tylenol 4 to 5 hours after his earlier dose. We do not recommend giving any further Tylenol as it may be harmful to the baby's liver. Instead, try to cuddle him and make him comfortable while being mindful of keeping pressure off the area. For the first 24 hours, wrap your baby's legs with a receiving blanket, also known as swaddling, to avoid leg movement. The more he moves, the more he is prone to bleeding. Here is how you swaddle your baby. We will show you once again in the procedure room. Lay your receiving blanket down on the diagonal. Fold down the top corner and place your baby down with his arms above the fold. Hold your baby's legs and fold the right corner of the blanket over and firmly tuck in the edge. Fold the bottom corner of the blanket up underneath your baby's arm, leaving the corner exposed. Wrap the left corner over and underneath your baby and tie the corner to the exposed corner underneath your baby's arm. Your baby is now swaddled. Over the next 4 days, it is very important to remember the following. Do not use any baby wipes or alcohol to clean the penis, as it will cause a stinging sensation. You may continue to use wipes on your baby's bum if you choose. Do not give the baby a bath, as it may cause a blood vessel to open. You can give him a sponge bath instead. Keep pressure off the baby's penis. Please do not carry him on your shoulder. Cradle him instead. To burp your baby, set him upright on your lap to keep the pressure off his penis. To provide additional protection, you may wish to double diaper your son. It's normal to see some yellow discoloration of the skin at the circumcision site. However, you do have to watch out for signs of a fever. If your child feels warm, take their temperature. And if they have a fever, you should call the doctor. As your son heals, make sure you can see the full head of the penis and that it remains fully exposed. Nothing should be attaching to the head or the rim of the penis. If you notice anything attaching to or covering the head of the penis, please call the office to book a follow-up visit. For more information on the healing process and the visual appearance, you can consult the materials in your manual. Thank you for watching and for choosing our Gentle Procedures Clinic.